Hello, I'm Tuba Khurshid and I'm here to present EFAST. EFAST or Extended Focus Assessment with Sonography in Trauma is a bedside ultrasonographic technique designed to detect peritoneal fluid, pericardial fluid, pneumothorax and hemothorax in the trauma patient. In any case of blunt trauma to abdomen, the initial investigation to be done is EFAST. If fluid is detected, the report is said to be positive. Then, vital signs are checked. If the patient is stable, CCT is done. If the patient is unstable, emergency exploratory laparotomy is done. However, if the report is negative, we must wait and observe and then repeat the procedure. In this procedure, we use a curvilinear probe. The probe tip is covered with an ultrasonic gel and then 5 views are taken. The first view is the subxiphoid view or the subcostal view. It evaluates pericardial infusion and cardiac tamponade. The second view is the right upper quadrant or the right lumbar view. It is a more sensitive view for hemoperitoneum. It evaluates fluid in Morrison's pouch, right pericollic gutter and perihepatic space. The third view is the left lumbar or the left upper quadrant view. It evaluates fluid in the perisplenic space or the left pericollic gutter. The fourth view is the pelvic view. It evaluates fluid in the pelvic space. The fifth view is the right and left thoracic view. It evaluates pneumothorax and hemothorax. EFAST has several advantages. First, it is a highly specific and highly sensitive investigation. It can be done very quickly, it is non-invasive, and it does not use any radiation. However, it has certain limitations. Firstly, it cannot detect fluid less than 100 milliliter. It cannot detect retroperitoneal hematoma. It cannot detect subcutaneous emphysema. Also, it cannot detect mesenteric tears, bowel injuries, or diaphragm injuries. Thank you.
So now we are going to talk about CECT abdomen, that is contrast enhanced computer tomography. So if a patient comes after some trauma, we have two options with us. One is that if the patient is stable, we can go for CECT. If the patient is unstable, then we can do EFAST. So in order to do CECT, first we have to inject contrast into the patient, or we can give them oral contrast such as barium solo. We can give gastrografin, iodine and barium solos, and after giving this contrast, wait for 2 to 3 minutes in order to check that there is no hypersensitivity reaction in the patient. After ensuring there is no hypersensitivity, we will do the CT scan, and as we are going through this COVID-19 pandemic situation, it will be better that if we take the CT scan of lung also in such patients. If a patient is coming with COVID-19, we will be taking their RT-PCR, but in order to assess the severity of the disease, it will be always better that you also take a high resolution CT scan. In HRCT of COVID patients, we will see a ground glass appearance. So it is saying that the severity and how the lungs had been affected by this virus. So always take the prevention and wear your mask and use the sanitizers. Thank you.